What a splendid introduction. Thanks to Chick for having me here. It's an honor. Uh, I bring you greetings from Liberia and the rest of the Liberian community. Um, so, okay, so as I was rightly introduced, I come from an organization called Public Health Initiative Liberia. Public health is PHIL for short. It's a community-focused public health organization that is working to promote and enhance the quality of healthcare delivery in Liberia, particularly through leadership, partnership, innovation, capacity building, and that of advocacy. We've been in operation since 2011. The idea of Public Health Initiative Liberia came about when we were studying our master's program, and we saw that we needed another sector outside of the health sector to be able to work with government as well as provide some local ownership and leadership within the health space. So it was predicated upon that we came into being. Liberia is divided into 15 counties, and currently we have offices in 4 of those 15 counties. We are working across 85 communities, covering 6 of those counties. Thank you. So we cannot talk about eliminating cervical cancer landscape without having a context of what is obtaining in Liberia. So, sorry, my slide. So Liberia has a population of about a little over 5 million. We're a very small country for the 2,000 square miles. But in Liberia, we have about 656 new cases of cervical cancer. Cervical cancer is the #1 cancer in Liberia, according to Globacom, and it accounts for 18% of all cancer cases and 30.9% of cancer cases in female. In fact, it is the leading cause of cancer death among Liberian women and the second most common cancer in women ages 15 to 44. So you see our very productive population, female population, are the one most affected with cervical cancer. At current, we do not have a national screening program. They are working in the space trying to work towards that. We have a newly established cancer registry. Great. We also do have a national HPV vaccination program that was introduced in 2019, targeting 9 years old girls. And according to WHO, you have only 1 in 10 girls in the primary cohort that have received vaccination. So it is in this space that Public Health Initiative Liberia is working. Basically, we work on demand generation for uptake of HPV vaccination using our existing program structures. We have one program that is ideal for adolescent program that works in school and also out of school. So under that program, we also do demand generation activities for HPV vaccination uptake. We also have our integrated community-based health program. Under that program, we work with community structures, formal and informal community health structures. So we have what we call Mothers Club. We have migrated that on our nurturing care intervention to Family Club. So in that space, we have opportunity of bringing the caregivers, guardians of the target group as well, to be able to inform them about HPV vaccine, as well as link them to services. We also do advocacy, as you heard in my profile. I do a lot of work in civil society. So That's one place we work with what we are doing at the community level. We are able to amplify the voices of communities and women that we work with as it relates to influencing policies and programs towards cervical cancer elimination. We also do have a screening and early detection program through our conduct of See and Treat mobile outreach services. And this is one program that is really dear to me because I lost my aunt, my maternal aunt, to cervical cancer. And it's one of the driving force behind the work that we do in cervical cancer elimination. So under this program, we use the mobile ODT colposcope, EVA colposcope, and that of the CT coagulation device that is portable, is cost effective. It doesn't need much electricity to be operated or technicality. We work with just nurses and midwives, provide them with the skills and the tools, and they go out and conduct mass outreach out there, targeting women. And during these outreach services, we also do link it up to HPV vaccine. The good thing, I mean, one of the interesting things is that HPV vaccine, when you talk about it, sometimes people look at it abstract, but then when you link it to cervical cancer elimination and people sharing their stories around cervical cancer, it gives them that so real moment as to why the vaccine is so important, and that if we need to protect the next generation of Liberian women, we need to have all of our girls fully vaccinated. And so that's it. So basically, I put this slide just for my EPI colleague. We've been working great, but also just thought to say that because there are other local institutions, civil society actors that are working in a space, and I think it's important to strengthen coordination, to leverage on the platform that they do have. Be intentional about partnering with local organizations. I say this specifically because most time in the coordination landscape or collaboration landscape, the actors that may be looking up to partners that are bringing funding on the table, but local institutions are bringing in experience, closeness to the population that is being targeted, trust and confidence from those targeted communities as well. Most of these interventions do not have specific funding that is being used to have them implemented. But because of the commitment we have towards eliminating cervical cancer, we leverage on existing programs that we have. We leverage on existing network that we have in the community. Every opportunity we have to be able to connect to the population as it relates to cervical cancer and HPV vaccination, we make use of that. So, okay. Thank you. This is just some of the work that we do, images from the field. So we partner with the Ministry of Health, and we have that awareness flyer. We also, like the EVA colposcope I was speaking of, this was a training session that the midwives and nurses are being, picture was taken from. That is a community awareness session that was being held. A parent and two of a kids that are of the targeted group were being engaged around HPV vaccine. And yeah, thank you.